Cristian, it's so good to have you here and to inform us about kind of the latest from Mediktor. What I understand is you've created this tool that allows patients to plug in their symptoms online or on their phone and guide them through getting the right care at the right time so they don't have to just rely on Googling their symptoms. So break it down for us. What is this? What is Mediktor?
Well, you did a good job explaining it. So we try to solve an unsolved problem in the world, which is the first step in healthcare. And people do the wrong thing, and you name it. We all go to Google to find out what to do next. And this ends up wrong. We do the wrong thing. We run when we should not, or the opposite, or just visit the wrong physician. A lot of other things. So we try to address this problem in a scalable and reliable way, guiding patients to the right level of care.
Yes.
And we do it with Mediktor, which is the most accurate virtual assistant for triage and pre-diagnosis.
Okay.
It's a bot that you just express how you feel, and you start a conversation emulating the same conversation you would have with a physician friend of yours to guide you through your symptoms, to end up giving a recommendation on what to do next and a list of possible disease you could be suffering.
So you're saying it's more free text. I don't have to choose between 5 things. I'm just typing how I really feel.
Yeah, we did a huge effort, and I think this is extremely unique from Mediktor, the natural language processing that we use at the beginning to manage your symptoms, how you express them with your words, and all together. I mean, the more natural way possible. So I have chills and fever and my belly hurts all together. This enables a very natural conversation and also very sharp, because we know all the symptoms at the beginning and we try to go direct to the point.
Yeah, I have to wonder, how did COVID kind of evolve Mediktor? I mean, obviously the need for remote triage grew so much. Did that kind of supercharge certain aspects of what you're working on?
Well, I think that we felt the same as the whole industry. I mean, a huge traction in telemedicine that, of course, meant a huge traction for Mediktor, just because Mediktor makes sense before any teleconsultation. You are sure that you are talking to the right physician, the right level of care, and saves time on the physician interaction.
Yeah. One thing I find interesting about Mediktor is that you have a global footprint. You're born in Barcelona, but what regions are you currently working in?
So we are in 26 countries now,
Yeah.
mainly Europe, Latin America, and North America.
Yeah.
That's our main regions, but we also going to other regions by opportunity,
Yeah.
and we have also now some deals going on in Asia.
Talk to me about why that is a focus for you, because a lot of entrepreneurs focus on one country. The complexity of thinking globally, even while they understand that their tool could be used elsewhere, it's difficult. So talk to me about why global health, global scale was important to you.
Well, I think that we had this mindset since the first day. Of course, you start on the environment that you know, and it's more easy for you, but pretty easy we start having deals from Latin America or Europe, just because we are near there.
Yeah.
And we had conversations, so it just happened. I mean,
Yeah.
we started closing deals and more, and opening more languages. Now we have 15 languages in the
Wow.
system, which is quite a few.
So you're matching these 15 languages with natural language processing, which
Yes.
sounds very complex.
Yeah.
To understand people's free text symptoms in 15 languages. Was that complicated?
Yes, it is, and we have a team devoted just to this engine, because
Okay.
it's extremely complex and it's getting bigger and bigger every day, because learns from the user interaction.
Yeah.
And it's better every day.
Talk to me about the impact on access to care when you start to roll out these scalable bots that help you understand what's going on, where you need to get care. You talked before about avoiding Dr. Google and mistakes there, but it's about more than avoiding something. It's about giving somebody access. So talk to me about sort of the patient impact that comes with this?
No, I really know today that one day we will not be able to access any physician in the world without going through a symptom checking tool like Mediktor. This day will come because we put order on the demand of health, and that's a huge improvement in both sides. In the patient side, because you know what to do since the first moment, and that's a big relief on you because you know, okay, I'm on a path for my care and it's suitable. And on the provider side, you have huge savings because people is knocking the wrong doors and doing the wrong thing that cost a lot of money to the system also.
Yeah. What does a system like this do for care coordination? I think about a lot of times people will use a triage tool when they want to go to the urgent care or the ER, but really it can also guide them towards mental health and guide them towards maternal health. So how does a triage bot like Mediktor play into patient coordination?
Well, in fact, we can go as sophisticated as we want in this, let's say, triage or directing patients because we have all the information that it's structured.
Yeah.
So we sit down with our clients and build up the recommendation schema, as we call it. So we just plug each of the cases that they want to manage within the right service that they have. So we can be as precise as we want.
Got it. What are you excited about? What's next for Mediktor?
Well, I think it's a very interesting year for us because we just fundraised. We are going big with the team.
That's right, you raised
13
million. Okay.
We are hiring a lot of people to have a global reach, to reinforce our software. So it's a very, very interesting year ahead. And we are focusing a lot in the US now.
Quick last question. Since you just went through a $13 million raise, what's a piece of advice about fundraising that you would give to an entrepreneur who is maybe earlier in that process?
Well, you will have to talk to a lot of people. I mean, this is, you need resilience and just to be patient, you will find the match.
Awesome. Cristian, I love hearing about what you're working on. Wish you the best for the next year, and we'll be watching Mediktor.
Thank you, Logan. I'm really glad to be here with you.
Awesome.
Thank you.
Take care.